Thank you, Speaker. My question is to Minister of Health and Long-Term Care. Minister, this afternoon, members of this legislature will be debating my motion, number 64. The motion calls on the government to immediately strike an advisory council on pediatric autoimmune neuropsychiatric disorder associated with streptococcal infections and pediatric acute onset neuropsychiatric syndrome, also known as PANDAS. The Council would advise the Minister of Health on research, diagnosis, treatment and education related to this disorder. PANDAS may affect as many as 1 in 200 school-age children and in almost all cases has been misdiagnosed. Minister, can I count on your support for my motion and making the PANDAS Advisory Council a reality?
Thank you. Minister of Health, Long-Term Care.
Thank you very much to the member for Sarnia-Lamton for his question, and I was certainly very intrigued when I read his motion because pediatric autoimmune neuropsychiatric disorder associated with streptococcal infections and pediatric acute onset neuropsychiatric syndrome was not something I learnt about in medical school. But this is actually, my experience is probably the experience of many physicians, and the member opposite has made reference to the fact that some of these rare conditions are often misdiagnosed. They may have symptoms that mimic other disorders and so on. So this is a very real situation. And we have recognized, our government has recognized that there are a number of rare diseases in this sort of a category, and we recognize how frustrating it can be for families, obviously for the individuals affected as well, when confronted either with no diagnosis or a mid-diagnosis. So I certainly look forward to the debate this afternoon. Thank you.
Thank you. Supplementary.
Yes, thank you, Minister. And my understanding, I spoke with your predecessor, and he also had lots of time for this. Minister, children affected by PANDAS often experience an abrupt onset of tics, obsessive-compulsive behaviour, and severe depression and anxiety after a common strep infection. In the members' gallery today, we have members of the organization of PANDAS Ontario, including Executive Director Carrie Henriksen and her son Jonah. Each and every one of our guests has a personal story of how their lives have been impacted by the fight to have either themselves or their loved ones properly diagnosed and treated for PANDAS. Minister, will you commit to setting aside some of your time, and I know your busy schedule, to meet with Ms. Henriksen and the families of PANDAS of Ontario to learn more about what our great province can do to help them? Thank you.
Thank you. Minister.
Well, thank you, Mr. Speaker, and I'm certainly very much prepared to meet with the parents and the individuals here today. Because of this important issue around rare diseases, the member did reference some of the symptoms that are involved, and I just want to reference back to OHIP Plus, because now we know through OHIP Plus many of the drugs required for these children, in fact, are going to be provided completely free. But also, I want to remind everyone that, in fact, our government has formed a rare disease working group. It's made up of experts who can explore how services for people with rare diseases in Ontario can be improved. And the group is led by 2 experts in this field, Dr. Ronald Cohen, the pediatrician-in-chief of the Hospital of Sick Children, and Scott McIntaggart, Senior Vice President, University Health Network. So we already have a group that can look at the situation regarding these 2 particular disorders as well. Thank you, Mr. Speaker.